Thanks. I'm happy to be here. Thanks for the introduction, Warren. And I'll get right into it. I'm gonna share pediatric stroke specific and brain injury resources. So I just listened to the latter half of the previous presentation, and much of this is aligned. The difference is I'm doing more showing than telling in terms of showing some of my personal journey, even though it's not specifically MSMDS. I know that many of you experience the same as me as a parent with a child who's had some type of brain injury. So who am I? As Warren said, I have a child who's almost 16 who had a stroke at birth. I also co-chair the Parent Advisory Council for what's known as the now Pediatric Stroke Network. And I started this work as a volunteer, but I now work half-time at Mass General. So what are we trying to do today? Increase understanding of what's missing, what are the unmet needs for kids and families developing after any kind of stroke or brain injury, and to share more about our model of family education and really to empower you, the parents, and if there are any young adults in the audience, them as well. Okay, so you know that if a child has a stroke or brain injury early in life, it affects the whole lifespan. And these pictures show hospital settings, but most of life is not lived at the hospital. My own personal story started when my younger child was 2 days old. So this is a picture of my daughter Zoe, who's 2.5, holding her baby sibling, who was 1 day old, and everything looked good. They're both ironically playing with their hands, which became a much bigger part of our story. And it seemed like things were fine. 24 hours later, we were in quite a different place. Echo had seizures in the night, and I was awakened 2 days post cesarean to stand for multiple hours in the special care nursery while my baby was shuttled to Mass General from a smaller hospital, Mount Auburn. I'm a single parent, so nobody could go with my baby. You could imagine the emotional challenges. So this was our first reunited moment after 36 hours apart. This, as I said, the journey starts at a young age, and there may be one-sided differences or weakness, and eventually a diagnosis. In my case, I heard the diagnosis that my child had had a stroke while I was still at the other hospital and my baby was at Mass General. Then you got discharged to home. In our case, we spent about 10 days in the NICU, although I wasn't at the NICU full time because remember, I had a 2.5-year-old who was home and I'm a single parent. So I was going back and forth and I couldn't drive because of the cesarean. So I had people bringing us meals and people organizing rides for me and play dates for my older child. Then there's a lot of rehab, a huge to-do list, which you heard about in the previous talk. And you may get a definite genetic diagnosis, as many of you have gotten. I still have no explanation for what caused my child's stroke. And then you go on to hopefully thrive in your family to the extent of what's possible. And then there's another transition as you near adulthood, which I'm getting toward myself. Okay, so this is the story that Patty, Dr. Mussolino, likes to tell, why this education series came about. So she was, highly medically trained, and after 17 years, her first day in the pediatric stroke clinic, a parent said, "Why do I come here every year? What are you giving me that I haven't found myself or through other parents?" And it was humbling to her. So here's that question. So she felt like she got fired from this job on day one. The journey is, you know, as we've said, through all these different stages. And the time in the hospital is the least time spent proportionately. There may be 10% of the time spent on rehab or habilitation for babies who don't have skills yet. Then there's school or formal education, preschool, daycare before school, and all the rest of life, which we estimate at about 75% of the time. So much of the educational resources that our team has built are focused on that 75% of the time. How can you make life worthwhile and therapeutic without it feeling like you're over therapizing your child, your family? And we do this with a team. We have this advisory council. These are just some of the partners here. And we're really trying to improve lives of children and families who've had stroke, building a community, raising awareness. Okay, so this is a video. So I want to show this because when a baby has a stroke right at birth or just before or after birth, often you can't tell which side is affected when they're still very young. So I'm going to try to use this micro mouse. I can't do it, Frank. Can you play this video? Yes. So look at this, and developmentally, it's very important for all of us to get our hands to our mouth. It's a matter of survival to be able to feed ourselves. So see how this is my little one, how they're getting their hand to their mouth. And can you tell whether the right side or the left side's affected? They're in a car seat, so the structure of the car seat actually supports the elbow. But there's not a lot of obvious difference between the two hands at this point. And they're half asleep, so but doing kind of typical 7-week-old stuff, right? Opening, closing, there's a lot of spontaneous movement at this stage. All right, so, whoops. Okay, by 4 months old, though, another 2 months had passed, and there was quite an obvious behavior. So by this point, Echo was persistently fisting their right hand. And little babies fist their hands. It's like a protective mechanism, but they usually start to lose that when they acquire the skill to reach. And Echo was reaching and bearing weight on their left palm, but not on the right fist. And the next slide is actually Echo's MRI. The first one is an unaffected brain. This cross section is through the middle part of the brain. And so it's a slice this way. Echo's stroke was on the left side of the brain. And even at 6 years old, Echo could say, when Patty said, "Why are you here for a stroke clinic visit?" Echo could say, "I had a stroke on the left side of the brain. It affects the right side of my body." And so you can see the stroke on the left side was quite significant, affecting 2/3 of the left hemisphere. Echo actually happened to have a second MRI at about 13 months, and that's the far right image. And there's a scar that actually looks significantly less involved than the scary image from when they were 2 days old. And why is that? Just like when you fall and scrape your knee, the ultimate scar is smaller than the original injury with all the inflammation. And that's true here, but it's not true for every child. So this is an open question. Why do some kids have a small gliatic scar like the one on the top right, and some have a large remaining brain injury. So that's an active area of research. Okay, this is another video. There are 3 in sequence coming up here. So when the right hand started to be fisted, it made it really hard for Echo to do what they wanted to do. So this is Echo in the stroke clinic trying to reach and play with that toy. You can see with their left hand, they're crumpling up the paper. And with the right, they're trying to grab the toy, but instead they swat it away. So their wrist is pronated, it's turned in, and they can't really grasp and release. Next. But on their side, they have more skill. So here, can you play that one? Oh. Here, Echo's playing with the pillow, the corner of a pillow. It's not a fancy toy, it's just an object in daily life. But you can see their full attention is, can I grasp this pillowcase corner? And they're using both hands. Gravity's helping because gravity is now hanging that right hand down to give them the ability to keep it open and to have it in their awareness attention. And then they're done. They move away. Part of why I'm showing videos of babies is you can see a lot in a very short time. All right, next. And I am trained as a movement specialist. I work with kids and adults who have movement disorders. And that's part of why I captured all these videos of my baby. This is magical. So I happened to get lucky. I was playing with shadows. You can watch their attention go from their hand, the right hand, to the shadow of the right hand. And then you'll see that Echo brings in their more skillful sensory attuned left hand to make sure that what they're seeing is their own hand. Because we now know they're 16 or almost 16 that their right hand has reduced sensation as well as reduced movement skill. So at 5 months, so much intelligence is apparent that there's this awareness of self and a shadow produced by myself and the light coming in through the window, and it's all there. So as I mentioned, I'm a solo parent. My kids were in childcare, and I needed to ensure that what was happening at childcare was aligned with what I wanted to be happening. And so the way that I achieved this was by developing one-pagers. And they were one-pagers that I would go over with that year's childcare providers, and they would put on the wall. And I tried to really distill it to the essence of what mattered to me. And I'd meet the new teachers, we'd go over it, they'd ask questions, and then they'd put it on the wall. And then it was a point of reference where I could check in to make sure they were doing what I hoped they were doing. These slides come from Dr. Wishart, who's here. We're talking about the developmental sequence. So all different domains of development happen along their own trajectory. And we sometimes talk about them separately, but really development is happening for a whole child together. So all of these curves are marching along together. And if we're doing any kind of therapy or just living life and supporting development, you may focus on one at a time, making those priority choices. Habilitation is distinct from rehabilitation. So if a baby has a stroke, they're not losing skills because they never had those skills to begin with. So therapy is helping them develop skills, which is then called habilitation. If instead it's a child who has a stroke or brain injury and there has been some development and skill development, then there's like a rupture to that. And the rehabilitation is an attempt to bring back the skill that was lost. And as you can see with this red line, often that then changes the trajectory. So there may be a new normal, a new baseline. But ultimately, the goal is, again, participation in life, as in for this little boy who's golfing with his father. And we like to emphasize that every child follows their own developmental trajectory. So part of my orientation is on neuroplasticity and what you can do in daily life to give your child multimodal experiences that help integrate development across all domains. So live life, like be in the rich world, have your kids coming in and out of this kind of setting, have them out in nature, experience variation, variety with the kinds of people they meet, the places that you go. And give time. Time is really important. So if any of us feel rushed, you know, the experience of feeling stressed and less able to develop more skills. So these are some of the principles that I hope that you can take with you. Our webinar series has been going, I have a slide in a couple with the statistics, but we span all kinds of topics. So it may be adaptive sports or braces for the affected foot and ankle, constraint-induced movement therapy, swimming, all kinds of things. Driving was a recent one. So yeah, we've been doing this for 6 years. Our first webinars, or we first started in person, much like this. We had 2 in-person conferences, and then COVID forced us to pivot to online, which actually allows us to reach families around the world much more effectively. And the speakers are coming from also all around the world, and we continue to look for more partners. You can scan this code to get to any of our past resources. There's a YouTube channel with all of the past events, and we have an upcoming, our 4th annual upcoming Play to Thrive Festival is, for those local to the greater Boston area, is on Saturday, June 21st. Okay, and this is just highlighting one example of sort of a stream of topics that have come over the years. We've had 3 sessions on cortical visual impairment, which affects many of the children affected by stroke or brain injury. Here's Play to Thrive that I mentioned. We have stations all around, outside and inside, at Spalding Rehabilitation Hospital. And it's really a fun festival for kids to interact with the station hosts and to get to come together with the other families and with clinicians and researchers. And as I mentioned, we have partners coming through the years. I haven't updated this for the last 2 years, but you can see we continue to network and grow our partnership. And that's really important. We help research programs find participants. We help families find fun and enriching things to do with each other and with their kids. And here are my 2 kids now, fully grown. Zoe, who's on the right, the one who, the 2.5-year-old big sister, graduates from high school tomorrow. And Echo's on the left, and Echo is wearing the t-shirt for Pediatric Stroke Awareness Month, which was just in May. And it says progress comes in waves. And I'm just gonna be vulnerable for a moment about how progress comes in waves, because I've been giving this talk for several years. And I think when Echo was maybe 9, 10, 11, I was sort of like, I'm done. They're doing great. They don't have some underlying condition that I know of. I'd say the last year has been excruciating. On the surface, Echo's smiling. They have, like a great family, a dog, big sister. But Echo's missed more than 100 days of school this year. And Echo has struggled with mental health challenges that ultimately are their story to share or not share. And even that, I thought, okay, last week they started at a new school. I finally advocated for that for the last several months. New school, 6 days in a row of attendance, 3 last week, 3 this week. This morning, on the day when I need to get up in Framingham and drive to Danvers, which should take an hour, they wouldn't get up. My sister's in town for my daughter's graduation, and she had agreed to drive Echo to school, which is 35 minutes away, because the van pool had texted me yesterday that they didn't have a driver. So I said, great, you can drive Echo to school at 7:35. I can leave at 7:15 to get to Danvers. Echo wouldn't get up. So I drove here, and it took an hour and 40. It was supposed to take an hour. It took an hour and 40 minutes because there was an accident. And on the way, I called Vanpool to say there's no driver needed this morning or this afternoon. I called the school to say Echo will be not there today. And then sitting in the back, once I arrived, I texted the counselor, their therapist at the new school, and I said, what's up? Did Echo indicate anything yesterday when they talked to you one-on-one why things would have changed today? So I'm just sharing this because they're the highs and the lows. The other high is that these kids are quite asynchronous. So Echo shared with me earlier this week that soccer has helped them get way better this year. So Echo's quite an athlete with soccer and ice hockey. And on Wednesday next week, they'll travel to the Atlanta, Georgia area for the 3rd time this year. And it's invited by US Soccer to participate in a training camp for the US cerebral palsy women's national team. And if they're successful, they will go to a tournament in England in August. So that is keeping them going. And I have to, as a parent, make this decision. Do I send my kid to play soccer in another state when they can't get themselves up to go to school? And for me, so far, the decision has been yes, because that's life affirming for them. So I just leave you with the complexity. Echo turns 16 2 weeks from today, and they're ready to learn to drive. And I'm highly motivated for that, because then if the van pool calls out, I can let them drive themselves to school. So I want to just offer myself as a resource. My journey is not the same as yours, but there's enough overlap and adjacencies that I've met tons of families. I have my own experiences, and just really happy to connect you to others who may have stories or paths that match yours more specifically. And if I can't find it, I am well networked and can find someone who can find it. So here's my email again, and thanks so much.